Welcome to Keva Health's podcast, where we explore the latest in virtual care and respiratory health management. Keva Health provides remote patient monitoring for respiratory illnesses, helping patients one breath at a time. In each episode, you'll be listening to our clinical team and leaders within the respiratory space discuss Keva's work and impact, as well as research and developments within the industry. Today, we invite Dr. Ramin, Keva's primary care consultant, discussing the hospital at home model of care. Hi, thank you for joining us here with us today. Can you give us an introduction of yourself and your background?
Sure, thanks, Ellie. My name is Ramin Rafi. I'm an attending physician practicing primary care in Michigan. I went to medical school in Southern California, UC Irvine, and I completed a residency in primary care, and I've been working as an attending for about the past 15 years. I worked as a general practitioner as well as a hospice director, and the company that I worked for ended up becoming the nation's largest ACO. ACO stands for Accountable Care Organization. And we basically proved to Medicare that it was more cost effective to provide primary care in the home than the office setting. And in part because of us, we were one of the largest participants in the Independence at Home study that Medicare sponsored. In 2019, Medicare passed a law allowing all Medicare recipients to get a visiting doctor in the home. You no longer have to be homebound to get a visiting doctor. So that was the direction things were going into. And then in 2020, COVID came and that interrupted things. But now as the pandemic is slowly winding down or getting more under control, I do think there's more of an effort to build a hospital at home division for all hospitals, because one thing that the pandemic has shown is that hospitals should be reserved for the most ill people, the more people that need a higher level of care, and simple levels of care can more than likely be provided in the home. And there are a lot of hospitals, whether they're academic medical centers or community centers, community medical centers, that are all building their own hospital at home divisions now, because they feel that they realize that is a more better use of the limited resources and the work staff that they have.
Okay, that's very interesting. So how long have you been working at Keva Health, and what about the company attracted you?
So I've been a consultant for Keva Health for the past year. I was attracted to this because Keva is one of the very few companies that are working in the RPM space. RPM is remote patient monitoring, and this is an extension of kind of the hospital at home. When I started making the house calls in the home about 15 years ago, we were still on paper charts. And then slowly the EMRs came about. And as technology got better, when we were initially like making the house calls, we had portable EKGs that were about the size of a heavy briefcase. And in the past 8 years or so, I'd say we had very lightweight EKG machines that were probably the size of a smartphone, that just plug into the laptop via USB. And technology got so much more advanced, and we were able to provide higher quality diagnostic tests in the home, such as x-rays and even ultrasounds were done in the home. So as an extension of the hospital at home model of care, I saw remote patient monitoring being in addition to that. And in December of 2021, during the COVID pandemic, Medicare actually started reimbursing for RPM, which is remote patient monitoring. And Keva Health is one of the premier companies that provides RPM in the pulmonary space. And I just thought it was a good combination with my experience with what they're trying to do. So that's when I joined them about a year ago.
Oh, that's amazing. And going off on that, can you speak a bit about the consulting for remote patient monitoring? So what's the industry like, and what does that work entail?
So the RPM industry is still very nascent. It's still very new. It's very young. There are a number of companies out there, and there are companies that are vying to be perhaps the best in each system, such as the pulmonary space, the cardiac space, the neurology space, and so forth. And nowadays, unfortunately, the vast majority of physicians are employees, and a lot of the pulmonologists are employees of hospital systems. I think it's very rare or unusual to find pulmonologists in private practice, although it still does happen. But it's an extension for the pulmonologists to them to be able to monitor their higher risk patients, the ones that have more exacerbations, using this technology with the remote patient monitoring. And they can use the technology to monitor these patients when they're not being seen in the office. They can follow them in their home, and it allows for more real-time treatment of these patients when they're having exacerbations, and help them get it under control, and ideally to avoid hospitalizations. Hospitalizations, not that they can't happen or won't happen, it's just one of the more expensive places to be getting healthcare. And if you can be getting healthcare delivered to you in the home or in the doctor's office, it's a much more affordable environment. So that's kind of the push to providing the care at home.
Do you
That's
think
fine.
that there were a lot of transitions within virtual care, especially after the pandemic?
Yes, I think virtual care is definitely here to stay. It will not, it depends on the patient, it depends on the circumstance, but virtual care will be a hybrid as to a level of care that people get. Myself, I'm 48 years young. I recently had a surgery, and the surgeon wants to do the follow-up visit with me virtually. There's no reason for me to go into his office. I can just talk to him over a telemedicine, and that saves me time. It saves him time. It's just a more efficient use of everybody's time and technology. So I do think virtual care is here to stay, but I do think that there are still obviously in-person visits that have to be done for certain visits like primary care or even surgery care, but perhaps talking to a psychiatrist or even a psychologist where the appointment is more so conversational, that can be done entirely under virtual care. But most physicians or clinicians will need to have some degree of physical contact to examine the patient more accurately.
Yeah, and going off of that, I understand that some types of care can be done virtually more easily than others. So where along that line does respiratory health fall? And like to what extent can patients manage their own respiratory conditions?
So I think part of that is how motivated the patient is. There are patients out there who are very much interested in taking responsibility of their breathing condition, and those are the ones that are going to benefit the most from Keva Health or RPM, and that's true in every organ system. Ultimately, the pulmonologist will give this little device, which is a very small size portable spirometer, smaller than a smartphone, that links to their smartphone via Bluetooth, and it allows them to track their own breathing patterns. And this can be done, in the home or even outside of the home. When they feel they're having exacerbation, they can do that, and they would get a loop curve, and they could get an idea of how severe their breathing situation is, and if they would benefit from an additional treatment or not. Or they can um, send it out to their pulmonologist in real time, and the pulmonologist can get back to them usually within minutes, as opposed to them being seen days later about what's going on and what would help benefit them to get the exacerbation under control.
That's very interesting. Why is RPM for respiratory care important in primary care settings?
Well, pulmonary is still one of the common. I think it's the could be the third or fourth most common reason people go into the hospital. COPD exacerbations are one of the more third or fourth common reasons people go into hospitals for admissions. Um, CHF can be number two, depending on the population and the elderly. UTIs is actually number one, but COPD exacerbations are still in the top three. So it's a a relatively large hanging low fruit to take advantage of, where if you help manage the pulmonary space and people with COPD, you will take a large percentage of the people from hopefully keeping them out of the hospital and from having these exacerbations. And that will ultimately free up limited resources that are available in healthcare and free up more of the patient's times so that they don't have to go into a hospital to have their COPD exacerbations treated. I think I think one thing that's been proven through the pandemic is that if people can get the same level of care in the home than going out, that would be preferred. Hospitals are dangerous places, not just because of all the microbes and the viruses going around. There's other things going on there. And if people can get a good level of care in the home, the vast majority of people would prefer to get their health care in the home.
And focusing a bit more on Keva Health, can you elaborate further on how Keva's program specifically utilizes RPM or virtual care?
Sure. So Keva basically partners up with doctors, whether it's pulmonologists, allergists, immunologists, or even primary care physicians. And basically, the doctors would risk stratify their own patients, and they would decide which of their patients be enrolled into these RPM programs. So the pulmonologists may decide to enroll their patients that are perhaps having more COPD exacerbations, but yet they feel the patient is responsible enough, then they want to take control of their health. They're the ones they would probably assign to be in the RPM population, and they're the ones that they would probably help follow on an outpatient basis to help minimize their exacerbations and hospitalizations. So, how quickly it can be implemented? It can be implemented as soon as the doctors agree to enroll in the Keva program. Keva is entirely virtual. They have a staff of nurses, and their software integrates online into the EMR system that the pulmonologists use. So they can go into the EMR that the pulmonologist or the allergist, immunologist, or any physician has, and they can go in and see their patient population, and they can actually sift through the patients, the doctors, um, patient database and choose the patients that would benefit the most, and or the practitioner can choose the patients that they feel would benefit the most. And basically, the next time the doctor was to see the patient, they can bring up the topic, and if the patient is willing, with the doctor's recommendation, they can enroll them into the program. So it's a relatively seamless process, just the doctors have to opt into it. The truth is, I think many doctors are not aware about RPM because it's something that has become more popular during the pandemic. And with everything else going on, it's probably not a high priority to the number of doctors out there as a possibility. But the doctor's time is also reimbursed by Medicare, and other insurers are doing that. So it would help provide another income stream to their practice and help make their practice be more viable and more financially viable as well.
That sounds awesome. Is there anything else you would like to add?
My experience with Keva is that they have patients that are very happy with the platform. They have a number of patient commentaries or supportive comments on how the process works. And I just think one of the reasons I'm doing this podcast is to not just make the public more aware of this technology that's out there, but as well as physicians. Many physicians out there are not aware about RPM, remote patient monitoring, and that it's a possibility for most doctors in every field that they're in, that this is a possibility for them to have a better following of their patients and to help minimize hospitalizations.
Thank you for that. And thank you for being here with us today. And I think the work that you guys are doing is amazing.
Thank you, Ellie. Thank you very much.
Thank you for listening to this episode of the Keva Health Podcast. If you or a loved one is living with a respiratory illness, we encourage you to visit our website at kevahealth.com to learn more about our platform and how we can help you. Our team of professionals is here to provide you with personalized care, and we look forward to partnering with you.